Hello everyone. I hope everyone is fine. Yesterday, I requested all of you to revise carpal tunnel syndrome. So let me share and we can begin. Right, these are the images of carpal tunnel syndrome. If I can maybe enlarge, wait, let me enlarge this one. Have a look at the image. Right. What do you see? Let me, yes, minimize it. This pink shaded area is region of numbness. So these are the areas where a person suffering from carpal tunnel syndrome could complain of numbness. But let me tell you, first we'll identify. This is the synovial sheath, blue one, and it's enclosing the tendon. These are the tendons of digitorum. This is the flexor retinaculum. This is the median nerve. See, so in between the tendons of the muscles, you could see this is the median nerve which gets compressed, compression nerve. So it gets compressed. Let's move on and have a look at the, yes, maybe this image. I'll tell you what that is. Actually, if I may show you what happens, that they say this carpal tunnel syndrome is a continuous and progressive condition which causes pain, and it's presented with, I'll tell you how it's presented. Just a second. So carpal tunnel syndrome, if I tell you, wait. This is the nerve compression, median nerve. This is flexor retinaculum, you could see. So basically, patient, like in the previous image I told you, presents with tingling sensation here, tingling sensation of lateral, 3.5 fingers, 1, 2, 3 and half, lateral 3.5 fingers. So there'll be numbness and tingling sensation of these three: thumb, index, middle finger, and half of the lateral half of the ring finger. And the causes I could show you, the causes are compression of the median nerve at the carpal tunnel. So this is the carpal tunnel below the flexor retinaculum, between, in this image you could see, or even, yes, here, you could see here, it's passing through or in between, median nerve is passing through or between, you could say, the flexor tendons. So you could see because of this compression, it becomes swell like this, and that leads to numbness, tingling sensation of all lateral 3.5 fingers. So what happens? The risk factors, it could be genetic, and they are also associated with the work. Surgeons, painters, pianists, people playing piano, certain people, whoever are working a lot with the fingers, with the hands, they are susceptible to this kind of condition. Diagnostic method, I would say it's very easy and simple. Most of it explains the profession of the patient, the history is very important, and physical examination. And if not, then one can do electrodiagnostic test. And because of electrodiagnostic test, I don't know what that, it's maybe of some commercial of someone, yeah, Indian. Okay, so that's again, it's showing transverse carpal ligament here. This is median nerve passing there, and this is carpal tunnel, space under the ligament, in between, yes, the muscles. So this is the compressed median nerve you could see over here. So how would you differentiate it from other conditions? So uh, differential diagnosis could be peripheral neuropathy, there could be radiculopathy, there could be plexopathy. And let me tell you about the treatment. Treatment is simple. You first of all try to treat with the steroids. If it doesn't get better, then you steroid injectables. If it doesn't get better, maybe you can try these splints. These are called wrist splints. If they do not work, then the last resort would be treatment, surgical treatment, in which you excise. I wanted to show you. You excise the flexor retinaculum. I'm sure it would be here somewhere. I'll show you the image. I think I had seen it somewhere. Lost it. Okay. So the definition, if you ask me, it's a progressive and painful condition. This is like, yeah. I'll show you treatment. All right. Surgical treatment, surgical excision of, if you'll do the surgical excision of the tendon. Right. Yeah. So there are no precautions that one can take in order to prevent it from happening. But here, certain advices are given that if you do ice, elevation, and massage, this can prevent the symptoms or minimize them to some extent. Anti-inflammatory medicines one can take to ease the pain, and once working, they can take more frequent breaks in order to give rest to the hand. So basically, these are the measures that one can take in order to prevent more, if you want to avoid surgical procedures on your hand, and if you want to avoid too much pain because of this nerve compression. Right, with this, I will end today's revision. Tomorrow, we can discuss more on detail about the flexor retinaculum. I gave one, I tried to give one revision previously, but it wasn't recorded, so I'll record again and we'll discuss that. With that, I will end today's revision. Thank you, everybody. Good night. Bye.